Okay. I work at St Mary's Hospital and my current role is a technical instructor, physiotherapy assistant. I'm based in outpatients, so I'm dealing with people who've had musculoskeletal injuries and problems. This week in particular I've been dealing with a specialised area which is working on shoulder rehab. So there'll be patients who have had surgery or recurrent dislocations, in investigative surgery and stabilisation surgery, which means they're trying to help make the shoulder stronger and more secure, so when the people are moving and using their arm there's less pain and more strength there for them. One of the things that we'll be looking at is their post-operative progress. It's a very painful procedure to come out of. It's a very complex area, the shoulder joint in particular, so we'll look at making sure that they have relatively pain-free movement. They're looking at a paced and progressed exercise program, so they can't simply just go into press up straight after the operation. You need some very fine tuning, bring them out of their pain threshold and start to progress them that way. And then over the next year or so that you're looking at to get them back to whatever it was they were doing before. We do get a lot of people involved in contact sports, so we'll be looking at getting them back to that, but in the same process we're trying to make sure they become more aware of what got them into trouble in the first place, if for example they were dislocating and things like that. Along with shoulders we look at other joints in the body and muscle tissue. So for example we look at ankle, knee and hip. We'll have patients that have come in who are experiencing pain through running, who have also had operations on the hip, and it's a similar sort of process really. We're looking at trying to get them to rehabilitate their walking patterns, get them strong, get them more aware of what they were doing wrong beforehand and send them on their merry way. So we don't just focus on shoulders, we do other bits of the body. The interviews are actually quite hard because, I mean, the first thing we're looking for is very simply a good common sense in that respect. People that can listen, that can communicate well, and generally really do want to care about helping people. It is as simple as that. You've got to really have a passion to wanting to help people, free them up from their situation that they're in at the moment and try and find as much liberation for them as possible. There'll be questions that we follow, that we ask, but also there'll be the spontaneous moments within the questions that you're asking. People will be able to reflect on things that they've experienced themselves. A lot of the time it will be something that they've experienced themselves. They may have broken their leg or they've been skiing or had some sort of injury and just become fascinated by the whole process of being rehabbed. They may just have a sporting background, or they may have someone that's gone through something a little bit more traumatic that perhaps involves long-term care in a hospital before being discharged. So we look for people that have had some experience, whether direct or indirect in that sense.